Across Africa, millions rely on local pharmacies as their first point of healthcare, yet many remain locked out of the digital economy. So what happens when community healthcare meets technology? That's what we'll be telling you here today on Take on Tech. We meet Zendawa, a platform that is redefining this sector. Talk to us at KBC Channel 1. The hashtag remains to be Take on Tech. My name is Stephanie Ayeta.
Access to affordable and reliable medicine remains a challenge for many Kenyans, especially at the neighborhood level where most people get their prescriptions filled. But one Kenyan health tech platform is using technology to change that reality by bringing informal pharmacies into the digital economy. Zendawa is a digital platform designed to help neighborhood pharmacies move from manual, paper-based operations into structured, data-driven businesses. According to Zendawa co-founder and CEO Wilfred Chege, many small pharmacies operate offline, making them invisible online and financially excluded.
Pharmacies can be characterized as the mom-and-pop shops in sub-Saharan Africa and pretty much the rest of Africa. And they're what we call chemists locally. And we are doing for them digitization primarily through an integrated but decentralized modular platform where they're able to access telepharmacy, pharmacy business management, as well as access to embedded financing.
Without digital records, these businesses struggle to access financing, manage stock efficiently, or grow sustainably. Zendawa's approach is intentionally gradual. Rather than overwhelming pharmacists with complex systems, the platform uses a modular model, allowing pharmacies to digitize step by step, starting with a simple point-of-sale system. This enables real-time sales tracking, better stock management, and reduced cash leakages.
The major challenge that we were able to identify was that most pharmacies are offline and they're underfinanced. So you get that when they're trying to leverage on market linkage through online platforms, they're not able to do so because of the investment when it comes to setting up a digital footprint. And apart from that, now tying it to financing, they do not currently have proper systems that can be able to make them bankable. So they are not able to leverage on data to credit models where they do not have to give collateral for them to access financing. So those are the main challenges that we were able to identify. And when breaking it down, not having access to those two elements has put them in a position where they can do last mile delivery of medication. They have inefficient operations in their stores, and they don't have access to working capital, be it inventory financing or just access to for daily utilities. So we do this through our go-to-market process, where our first touch point is a feasibility study. So we get to understand the level of tech adoption in that pharmacy and the level of tech savviness. I think I mentioned that our platform is modular, so all the different modules can be activated independent of each other. So to ensure that they are not overwhelmed, giving an example of a chemist that is operating on pen and paper, we go in first and do a training on just operating a POS. So this is how they're able to capture data on a point of sale system that is available online for them to be able to seal cash leakages, as well as seal operational inefficiencies, that is managing stock as well as capturing new inventory coming in. So once they've had that exposure and they're able to streamline operations through having a point of sale, that's when now we bring in the embedded financing element, because we find that if you're operating on pen and paper, most likely you do not have the required stock levels. That's why you go into one pharmacy and you're told that I cannot find this particular drug, and you need to either get a substitute of the same, or you have to go to another pharmacy to get the product. So with embedded financing linkage, they're able to get inventory financing as well as working capital if they need to expand their space for shelf purposes. And once they have optimal stock levels, we now activate for them the telepharmacy module, where they become a fulfillment partner, and end users like myself and yourself can go to the marketplace, order for drugs, and it's going to be allocated for fulfillment from the nearest pharmacy within the network that we've been able to activate.
The impact has been tangible. Pharmacies on the platform have reported up to 15% reduction in cash leakages, lower losses from expired drugs, and in some cases, sales growth of up to 30% simply by becoming visible online.
We have pharmacies saving up to 15% of their cash outflows. That is money that was, or cash leakages rather, not cash outflows. So money that cannot be accounted for. We have a very good case that was recently highlighted even with Microsoft, that they used to have expiries that used to cost them upwards of 6,000 shillings monthly. And currently they're just through other cash leakages, they're just having lower than 2,000 shillings in monthly cash leakages. So you find that this is having a direct impact, and the results are measurable, because apart from saving them money with selling inefficiencies, we have pharmacies that through our market linkage have increased their sales by up to 30%. So somebody who was earning let's say 10,000 shillings, we were able to do market linkage because there is no upfront cost involved. They're doing upwards of 30,000 Kenyan shillings currently, and that has been attributed to the fact that they're discoverable, and the end users get to access the medicines at the same price point.
Okay, wonderful. Now, this is really heavy on helping the pharmacies.
Yes.
What about the customers?
So what we are doing is, because our model only works once we have a large enough network of pharmacies that impacts where you're going to collect the drug if you order with us, or if you want home delivery, it's going to impact the delivery fee. So that is why we're very heavy, but the end result is the end consumer is really going to feel the impact of Zendawa, because we are going to ease access and reduce the associated costs. Because with having such a large network, our next steps will be to leverage economies of scale to get price discounts that will be negotiated on behalf of the end users. So it's something that we are leading up to, and I'm sure you'll be able to tell us, hoping you'll be a customer with us.
For consumers, access is designed to be simple and inclusive. Users can order medicine through Zendawa website, web app, or Android app. Prescription drugs required verified prescriptions, while over-the-counter medication can be purchased and paid via M-Pesa. All pharmacies on the platform undergo strict verification, including licensing and regulatory compliance. Technology is at the heart of Zendawa's model. The platform integrates artificial intelligence tools to support credit scoring, analytics, and reporting, while prioritizing data encryption and privacy to ensure user trust. Looking ahead, Zendawa is exploring USSD solutions to reach users on basic mobile phones, further bridging the digital divide.
So what we're currently doing is probably a few quarters away from launching, but we want the service to be able to run on a dumb phone, that is through USSD. And this will be able to break that barrier of internet accessibility. And when it comes to the adoption or the tech savviness on the consumer side, we plan on working with the practitioners themselves, because once we have fulfillment partners at the grassroots level who have been able to adopt technology and understand the vision behind the Zendawa, they will be best placed to communicate this to the last mile consumers as they walk in, given that if you're using a dumb phone and have limited internet capacity, then us reaching you as Zendawa will take more time as compared to where you walk in daily.
That's it on Tech on Tech. We'll definitely love to hear your thoughts on what you think about digital healthcare in Kenya, especially after that story you have watched on Zendawa and how it's redefining this space. Talk to us at KBC Channel 1, #Take on Tech. I will see you next week, same time, same place. Until then, let's keep it tech.